This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.
Welcome to Expanding Access, a podcast by Behavioral Health Tech, where we explore the cutting edge of mental health, substance use, and autism and IDD care. Each episode features insightful conversations with industry leaders who are driving real change through technology and innovation. Whether you're a provider, payer, or just passionate about expanding access to behavioral health care, you won't want to miss these stories. Let's dive in. Hello, everyone. I'm Solomay Tibabu, your host of the Expanding Access podcast, where we discuss all things expanding access to mental health, addiction, and IDD services through health equity, technology, and innovation. And so, of course, I'm so excited for our guest today. Brittney Riley has had a lot of experience investing in and supporting in solutions that are within our ecosystem, improving the mental health and well-being of especially youth. And so before I get into it too far, I would love for you to introduce yourself, please, Brittney.
Hi, Salome. Great to be here with you today. I'm Brittney. I lead the direct investing at Pivotal Ventures. I have been there a long time building out our venture portfolio. I think we're going to get into how I got into all of that. And, I'm just excited to chat with you about what we're up to and what we're excited about in the future.
Awesome. Yes. Why don't we start there? How did you get into this space?
Yeah, so my journey into venture capital, which is where I mostly invest, kind of started on the operating side. I was at a few different startups, one in the health tech, digital health space, and one in the consumer health space. And that's where I first interacted with VCs and was really curious about kind of how their job worked. I think I was also a little bit disillusioned living here in San Francisco, working in consumer tech with how much money was going to problems that I felt weren't as pressing. And so I really just had this question of how could I sit on that side of the table one day and how could I help direct money to problems that I thought were really important to solve in our world. So that kind of question has led me on this 10, 12-year journey of investing in spaces that are mission aligned and in kind of some of the biggest problems affecting our country and our world today.
Amazing. And what a great place for you to be able to make that impact. Of course, Pivotal Ventures has been a wonderful partner of behavioral health tech, but I think there's a lot of questions around what all does Pivotal Ventures do? Can you talk a little bit about that? Philanthropy, investing, all of the above?
Yeah, of course. So Pivotal Ventures is an organization founded by Melinda French Gates with a focus on accelerating social progress by removing barriers that hold people back. And we're a group of organizations that make both for-profit grants through Pivotal Philanthropies, and then we make investments in funds and startups through Pivotal Ventures. We really think about, when we take a step back, what are the different levers that we can use to drive forward our mission? Our philanthropy often serves as kind of a catalyst, and then our investments kind of help scale market innovation. I think our work in mental health is a great example of this. We've done lots of kind of philanthropic work to spur the ecosystem, especially within youth mental health, and kind of close some of the care gaps in youth mental health. And on my side of the house, so I sit on the investment side, we've made investments in both funds that are thinking about health equity and advancing that work, and then in companies also that are scaling solutions in mental health.
Yeah, and I'd say catalyzing might even just be an understatement, even within youth mental health. Who really has been more prolific than Pivotal Ventures to make such an impact, for profit, nonprofit alike. Of course, I had an opportunity to experience that running the Upswing Fund for Adolescent Mental Health, one of the first organizations to pivot quickly into supporting youth mental health organizations, especially those that were focusing on LGBTQ adolescents and adolescents of color and getting them the support they needed through COVID. And that was just one of so many initiatives that Pivotal has supported and transformed. Now, it'd be great to hear a little bit more about specifically in your department. Can you talk a little bit about the investment strategy at Pivotal Ventures?
Yeah, so our investment strategy all up is focused on really advancing the broad mission of Pivotal with a focus on advancing women's power and influence. And we kind of have two pillars to that strategy. We invest in funds and then we invest directly into companies. On the fund side, we have 24 funds in our portfolio now, mostly all venture capital and early stage venture capital. And we look at funds, that have diverse leadership and kind of invest across all different strategies and sectors. And we continue to invest in kind of new emerging funds that we think are going to be category leaders and are really thinking differently about how they allocate capital and how they spur innovation. And then the second pillar to our work is the work that I lead on our direct investing. So we invest in Series A and B stage startups, again, that are advancing women's power and influence. And we can take a thematic approach. So we have a few themes within that strategy. One of them is reducing the burden of care for families. Mental health sits firmly in that theme and is one that we've kind of focused closely on. And then a second theme we actually just have launched around financial access. Both of these are, spaces that we know predominantly and disproportionately affect women. And so we think about how if we can invest in solutions within this space, we will ultimately kind of help drive forward our mission of advancing women and families.
Right. And your team has been very thoughtful about your strategy because it's not just the impact that the companies are making with so many individuals who are facing caregiving challenges or financial stability, but it's also so great to see the emphasis on funding the diverse fund managers as well and the entrepreneurs. Because, it's the same statistic for how many years. It's like single digit percentages of female fund managers getting the funding they need, which of course impacts the entrepreneurs and so on and so forth. So it's just such important work that you and your team are doing.
Yeah, and I think that's why I love working at somewhere like Pivotal is we can kind of think about the system all up and think about where there are kind of opportunities to advance. I mean, on the fund side, we've actually in the last 10 years doubled the number of female partners at funds, and not just us, right? I think we've seen the ecosystem double. And I'd like to hope that that has had some effect on the things that are funded and the overall kind of industry, but we'll see. It's definitely a time of challenge across the industry. And I think will require a lot of resilience from folks like us that are funding in this space. And of course, all of the people on the investment side and on the founder side building in this space.
That's so great. And again, such huge impact. Can you talk a little bit about any of the companies you've invested in recently?
Yeah, for sure. I mean, one company that I'm really excited about and kind of fits within the conversation that we're talking about is Little Otter. It's a kind of full family mental health company, and they started by treating kids with pediatric mental health and specifically designing their solution and the providers that they bring on for kids, but then have expanded as they've gone to really think about holistically about whole families. When you treat a kid, they live within a family unit and an ecosystem. And so we need to kind of think about the household that they live in and the kind of dynamics within that household. So they've expanded to full family care and are seeing incredible results.
That's such a great example. Thank you, Brittney. I know the Little Otter team has done such great work, Dr. Egger and Rebecca, these last few years. And of course, if you're going to impact youth mental health, how can you do that without not also supporting the caregiver? So makes a lot of sense and wonderful to hear how they've evolved. And I know another category of supporting caregivers and women is a company that you have in the maternal mental health space. Can you share a little bit more about them?
Yeah. So, I mean, they're broader than maternal mental health. So we invested in this company called Millie, which is really thinking about midwifery-led care and kind of taking women through pregnancy and postpartum in a much more holistic model. And the kind of tie into mental health, I think what I've realized is as we are investing in this space around care, a lot of the companies are kind of maybe don't seem like a behavioral health company on the surface, but when you dig a little bit deeper, they offer behavioral health services or the solution or care a model that they're providing really does have an effect on the patient's mental health. And so we're kind of trying to think about that as yes, investing in companies that are directly affecting that problem, but then how can we also kind of build solutions that across the board kind of have a mental health focus. So Millie has seen like a reduction or remission in mental health from their patients as well, regardless really of their utilization of the behavioral health solutions. But because their early kind of hypothesis is because they're still providing so much support upfront and postpartum, both coming to the women's house after giving birth and providing them upfront with a plan and a doula to kind of help guide their birthing journey, that they see this like real reduction in postpartum anxiety and depression. And so again, like I think we need these kind of specific solutions when there's acute problems, but we also need to be thinking of mental health as like a piece of the broader care plan.
So many good points embedded in that. It's like, for one, how can there be any health if mental health is not addressed? How can we be successful in any one of these categories, chronic disease, so on and so forth. But also the issue areas that your team is investing in, like these, I would hope for the investors in the audience would recognize that just the ripple effects of investing in these populations impacts everybody else. It's like you invest in women, you invest in literally everybody, and such high impact work that your team continues to do. So thank you so much for sharing those examples. Perhaps I can ask you, what are you excited moving forward in this space broadly or maybe beyond?
Let's see, a couple of areas within this kind of care. Well, like I said, we're expanding to financial access. So I'm really excited about that. And I'm excited about the intersection of financial access and care. Like nobody could pay for care and nobody can get this or the services that they need. And so how do we kind of unlock some of those services that already exist? And then how do we help people better plan and pay for care that they need? So that's an area I'm really excited about. I would say we're also just thinking a lot about kind of the broader infrastructure of care. We'll continue to invest in some of these kind of more direct care solutions like Little Otter and Millie that are kind of, providing directly interacting with patients, but also thinking about what are those kind of underlying challenges that is keeping care from getting to patients or keeping care from being equitable and what are the unlocks on that side. So that's an area I'm really excited about. I've been thinking on the last one, I guess I would say, is a lot about engagement and how do we kind of, especially within Medicaid and Medicare, how can we better help people navigate that process, especially maybe with lots of changes coming up? And how do we, again, like kind of think about making these systems, kind of the infrastructure system, more resilient so that people can access it a little bit better.
Interesting. So you're saying just because the intervention exists, if there's no real access to them, we're not really unlocking access, are we? So we need to think, what are the distribution models? What are the systems that need to change to actually make those connections and engagement to care? Obviously so powerful and important for any of these tools to be successful. And so wonderful to hear that. And it's so easy to get disillusioned with the state of healthcare and paying for healthcare in 2025. And I know for me, it's just like, oh, it's so big and it's easy to turn a blind eye. But your team is really leaning into how can we invest in the next solutions that are going to unlock this and really create so much relief for so many families. And that's just wonderful.
Yeah, I mean, I think that's why I like my job. I get to talk to people who are really focused on where there's opportunities and kind of seeing those opportunities before others and solving some of these really tough challenges. So I don't see the system becoming less complicated. I only see it becoming more complicated. And so that's kind of this infrastructure piece is how do we navigate that? How do we help people or organizations kind of navigate that to kind of drive forward our kind of continued mission to reduce burden of care for families?
Mm-hmm. Yeah, I'd have to agree, unfortunately. In light of that, our complex healthcare system, what have been some common challenges that you've seen early stage mental health, women's health, so on and so forth, startups What are some of the barriers that you've seen them stumble into pretty often?
I think within mental health, and we were chatting about youth mental health specifically, a space that we've spent a ton of time in, and both kind of on the philanthropic side and on the investment side. I think there's all the challenges we kind of always talk about, which is the provider constraint, the fragmentation, the reimbursement rates. And then you have these added challenges around solutions not being built for kids or teens, and having multiple stakeholders and kind of indirect paths to the patient, like whether through parents or whether through schools, and kind of what that means for engagement. So lots and lots of challenge. But again, like maybe it's because this is my job to be like, where are there opportunities? I think in the youth mental health space, kind of like what I was talking about with Little Otter, I think there are benefits to serving that besides just the overall impact that you have. Of course, like children do have some more infrastructure than adults. They have schools, and a lot of parents often get care for their kids over themselves. So you see kind of higher engagement on that side. And then the stigma for young people has changed so much with our youth. Like we're still kind of battling that, I would say, across the board, but more so with maybe us old people. So who, that stigma kind of runs really deep. And then kids' brains are so malleable. You have all this opportunity to change and have really great outcomes like relatively quickly in a way that you don't really see with adults. And then, like all the things that I was talking about with family care, like, right, you can treat multiple people at once. You're not having to acquire individual patients one by one. So I think it's a great space. There's so many challenges, but what I've learned working across these kind of big, tough, hairy problem sets is that there's always going to be so many problems, and it's where and how can you weave through them to build, an enduring company.
Love that. Not the part where I'm not considered a youth, not even under SAMHSA's definition of like 33 years old or something, but the part about, we talk so much about the added complexities of youth mental health startups being successful, even more so than adult-focused startups for all the reasons you mentioned. But there's also unique opportunities for youth mental health startups that perhaps adult-focused ones can't enjoy, including the reduced stigma. The next generation is demanding better experience and better access to mental health care. So I think that is a nice bright light of hope for payers, providers, innovators, investors in the audience. And that's very exciting. I have to ask you, if I can, one last question. I'm sure we do have quite a few companies in the audience that would be excited at the opportunity to pitch their wares to you. What advice would you give a startup today in 2025 to successfully pitch you?
To successfully pitch me, I mean, I think we're thematic investors. So we're usually coming to the meeting, understanding broadly the market that you're working in. And really, I'd say the best pitches are conversations, and not just conversations, but generative conversations where we both leave feeling energized and excited and like we learned something new. And so I would say that's the best way to pitch me, but not just me, like that's just the best way to pitch. I think that's the only way to have energy throughout what could be a grueling fundraising process. And if you're not feeling like that, I think it's both reflecting on how you could evolve the conversations or maybe, who you're chatting with. But I hope that everyone gets to kind of experience those conversations with investors, and investors get to experience it with founders, because it's really where the magic happens.
Wonderful. And yes, embedded in that response too was thematic investors. If you are not in the categories that Pivotal or other VCs are clearly stating on their websites, probably would be a waste of time to approach them with something that is not in said thematic areas. Very good advice. And speaking of which, for those listening in, if you are enjoying these kinds of conversations, we had over 50 venture capital funds at BHT last year, and we're looking forward to regrouping with so many investors across various stages of healthcare VC that are looking for the latest and greatest. So save the date for the Behavioral Health Tech Conference later this year, and excited to connect with all of you there and engage in these kind of meaningful conversations that Brittney is mentioning. And so thank you, Brittney, for your time. So appreciate catching up with you and hearing your great advice.
Thank you, Salome. It's always a pleasure. I'm your number one fan. So I'm excited to be here. And I hope everyone comes out to the conference in the fall. It's a really great time and an incredibly good use of time. So
yes, what she said. Thank you, Brittney. Until next time. Thanks for tuning in to Expanding Access. We hope you're feeling inspired by today's discussion. If you've enjoyed the episode, subscribe and share it with your network. For more content and opportunities to get involved in transforming care, visit behavioralhealthtech.com. Until next time, let's keep pushing boundaries and expanding access together.
This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.